Welcome everybody to Nurses Nix Nicotine, Nurses Supporting Tobacco Dependence Treatment. This is our online chat in celebration of National Nurses Week from the New York State Smokers Quitline. I am Tony Astran, the Public Information Specialist with the Quitline. And again, we want to say thank you to nurses for everything that you do, and we're happy today to have 4 nurses with us statewide to chat about tobacco dependence treatment. A few housekeeping items. This panel discussion is being recorded. All participants are muted. Please direct your questions either to me or use the Q&A feature. And as a reminder, all participants are invited to request an order for up to 100 free Quitline brochures. You can find those details by visiting nysmokefree.com and visiting our print resources section to see what's available. As mentioned, I'm Tony Astran. I'll be one of the moderators. Simply I'm here to give everyone a welcome, and then I will be at the controls keeping tabs of our chat functions and making sure that we're running smoothly from a technical standpoint. With me as well today is Paula Celestino, Director of Client Relations and Outreach, as well as Patricia, our Marketing and Outreach Coordinator. Both Paula and Pat will be asking questions of our nurses as we go along, and a little bit of information about the Quitline to come towards the end. But enough about us. Let's go into the stars for today, and you see them on video right now. We have Rose Aulino with Columbia County Mental Health Center, Kathy Eliason with Cayuga Medical Center, Patricia Folan, Director of Northwell Health Center Tobacco for Control. Hang on one second here. There we go. Gotta love multitasking and had a box just pop up here. And then we have Ann Lawton with St. Peter's Health Partners Cancer Care Centers. Our goal for today is that this panel discussion and chat will provide a forum to identify, recognize, and celebrate the role nurses play in tobacco dependence treatment. A little bit of an agenda for how things will go today. We'll have our panel discussion and chat, a brief overview about Quitline services, as well as our patient referral programs, and a few available resources that are tailored for nurses. A few closing remarks, and then at 12:45, our bonus chat. And speaking of which, again, you can use the chat box to ask your questions, interact with your peers, and please know that as we go through the individual questions with our nurses today, for any questions from participants, we will be addressing those during the bonus chat feature of this online chat, which will start at around 12:45. Anything that we're unable to get to or need further follow-up on, we'll be addressing those through email, and be sure to send that to everyone. And likewise, for everybody who is here with us live or perhaps could not join us live but registered, we will have for all of you slides from today's presentation, as well as resources and a link to view the recording afterwards. With that said, I am going to stop sharing, and now you should be able to see our fantastic panel of nurses. And with that, and with every question that we are asking of our nurses, we'll have each of them respond for about 2 to 3 minutes to keep the conversation rolling, and then we'll turn over to the Quitline portion of things to wrap up, and then of course have our bonus chat with the audience at the end. So with that, we will turn things over to get started with Pat Bax, who will ask our first question. Take it away, Pat.
Thank you so much, Tony. And as a fellow nurse, I want to wish all the nurses today a very happy Nurses Week, and I hope you enjoyed your Nurses Day yesterday. Let's start off with Ann. And we know that nurses are the largest healthcare workforce and are involved in virtually all levels of healthcare. What is the role of nursing in patient care with tobacco cessation?
Well, it's a great question, and I also want to just add Happy Nurses Week to everyone. I really think nurses need to take the lead in tobacco. I'm sorry, I heard something. Anyways, I really think nurses need to take the lead in tobacco cessation. And this is why. Nurses are consistently voted the most trusted and respected member of the healthcare team. We have a valuable voice, and we need to use that voice for good. And this would be one place to put it. Nurses are well placed to deal with the disease of tobacco addiction because sometimes we're the ones that spend the most time with the patients. And because of that, we know who the vulnerable people are. We know some of the barriers that they face in their tobacco addiction, and we can help them break down those barriers and provide them help. And really, we also can be their cheer squad, their support team. Stopping smoking is super hard, and we need to be very, very supportive of that with our folks. And it's also within our scope of practice. You know, this is something we can take on. This is something we can educate ourselves with. This is something that we can even indicate which nicotine replacement therapy would be the best because it's over the counter. You know, do we really want our highly specialized physicians spending time dealing with tobacco cessation, or do we want them doing what they're specialized in? They haven't received much training. I think it needs to fall back to the nurses. And I think along with that, we need to make sure that our nurses are educated and feel really comfortable with this topic. And that's something that I have spent a lot of time trying to do, is reach out and provide education for nurses. And again, I really believe this is something nurses need to take the lead on.
Well, thank you, Anne. Those are excellent points. And moving into the next question, how can we as nurses promote a culture responsive and open to tobacco cessation?
This is $1 million question, and it's something that I struggle with frequently at the organization I work for, and I'm sure some of you do as well. This is kind of a disease that is thought of as shameful and dirty, and people don't like to talk about it. However, we need to. And the first thing that we need to do is we need to promote policies within our organizations that deny people the option to smoke on medical campuses. And along with that, we need to offer judgment-free help to those who need to quit. And that includes giving free nicotine replacement therapy. So that's the first thing. We need to improve our electronic medical record system to make it easy for people to document someone's smoking history and their smoking addiction. And along with that, we need to be able to make it so it's very easy for our providers and our nurses and our healthcare professionals to provide evidence-based treatment to help people. So the next step is we need to view this as a disease. It's not a shameful thing that lazy people with no willpower have. This is an actual addiction disease, and we need to see it that way. Instead of simply telling people you need to stop, or that's disgusting, you need to stop, we need to really change our language and make it a positive culture on our part as well, and offer help. That's what's really important here, is that nurses should always be available to help. Even if people didn't say, no, I don't want it, I don't want it. You can say, you know, I respect your choice at this current time, but I want you to know that if you ever change your mind, I will always be available to help you with this. We need to normalize that this is really hard. And for many people, it takes more than one quit attempt. And again, just telling people to stop does not work. We need to recognize that they may have to try several times, and they need to understand that we'll be with them every step of the way, every single time. And finally, like, the nurse's hidden secret here is that nurses smoke too. Let's help them. No more hiding in shame. We need to reach out to our peers and say, look, I can help you with this. Please let me help you with this. And along with offering support, we need to give them free nicotine replacement therapy. If we don't want them smoking on our campuses, then give them a free patch at the start of the day and let them work their 8 to 12 hours and not need a smoke break. And education is a huge one. education and outreach to our healthcare professionals, from our healthcare professionals and into the community to spread the word that this addiction is not hopeless and help is available. And we can do this. We can, as nurses, turn this into a culture where we are open and available to help people, even though it's cigarettes and thought of as a dirty, shameful secret. We need to stop doing that and just be open to help. So those are my answers.
Oh, Anne, I wish I had an applause button here where I could press it. You were truly a champion, and we thank you for your answers, which were just incredible. So I really appreciate that. And thank you for being a support of the Quitline and for all the efforts across the state to help us make New York State smoke-free state here. And let's move on to Kathy, who is another wonderful champion. And Kathy, your first question is, as we emerge from this COVID-19 pandemic, hopefully sooner than later, what can be done to facilitate and better assist nurses in providing cessation support to tobacco users in healthcare settings?
Well, thank you, Pat, for inviting me here. I think nurses support, I know nurses support, encourage, and advocate for the patients every day. We do it every day. And during the pandemic, I've seen nurses as heroes. You know, we're caring for critically ill patients. We've been testing patients, vaccinating thousands of patients. So as we emerge from this pandemic, which hopefully is soon, nurses have to realize their influence. I agree. Nurses have to realize that we can support patients in their cessation efforts. I think a really key thing for nurses to realize, acknowledge we cannot change anyone's behavior. I think we need to take that in, and despite all our efforts, some people are not going to quit, and that's okay. Acknowledge that. I agree with Anne, we have to normalize quit attempts. Slips are just part of the process. It's not a failure. So many patients will say, you know, I'm afraid to try again. I'm going to fail again. You know, help them realize that's normal. There's numerous quit attempts involved. And every time a patient quits, they learn something from that quit attempt. And sometimes that will build confidence in the next quit attempt. So be positive with your patients. Do not judge them. As Anne said, nicotine is a chronic illness. Nicotine dependence is a chronic illness. I think another thing nurses can do, recognize every little step your patient makes. No matter how small it is. If you have an OB patient or a parent of a pediatric patient and they tell you, I gave up smoking in the car, that's awesome. You know, don't try to go into, well, why are you still smoking? You gave up smoking in the car. You've recognized that secondhand smoke affects your children or your future child, and you've done something spectacular. And we have to recognize that to them. For an outpatient, it said, hey, I'm only having one cigarette now in the morning. Or I've given up one cigarette in the morning with my coffee. And they used to smoke 3 and now they smoke 2. Recognize that. They still smoke about a pack a day, but instead of a pack a day, now they're smoking 19 cigarettes a day. Say, hey, in a week you've smoked only 7. In 3 weeks, that will be a pack less. Patients respond when we tell them that they're doing something positive, even though they're still smoking, and they'll respond to you. If you have inpatients, you know, they can't smoke in the hospital. So a lot of times they're struggling with withdrawal. Make sure that they have adequate nicotine replacement while they're in the hospital so that they can manage their withdrawal symptoms, but recognize that they're having a hard time. And, you know, you're there for them, and hey, you made it through the whole day and the nicotine worked for you. So maybe when you go home, it will work for you. So I think those small things that patients see as a big thing, we have to recognize. And I agree with them, we have to be aware of the medications, the 7 FDA-approved medications, and educate them, you know, that your chances will be doubled if you use medication. Medications can be combined. Something I hear a lot of confusion about sometimes is the gum. You know, it's not gum. It's more like a resin. You chew it, you park it, you know, learn these things from the resources that we're going to provide you with the Quitline, and then help your patients. The biggest support you can give patients is to never give up on them. So I think nurses, I have to share this, got this from a patient. Nurses rock, and realize that.
Oh, that's awesome. That's terrific. And I love your approach, Kathy, you know, just looking at it not as a punitive action, but as the best thing that a patient can do or tobacco user can do for their health. So I love that. And celebrating the little successes is so important. So what response would you give? We often hear this from healthcare professionals, including nurses, who say they don't have enough time to talk with patients about their tobacco use due to conflicting priorities. There's so much that has to be done. So what suggestions or recommendations would you give?
Well, I think a key finding of the 2020 Surgeon General report found that over 40% of adults who smoke do not receive adequate advice to quit from healthcare providers. So, hey, let's change that, nurses. Let's do it. It's time to do it. I know it's precious. Time is precious. I mean, I'm a nurse. It's precious. You're getting new assignments and things that stretch you to the limit, but you have an opportunity every day to affect nicotine dependence and help prevent suffering and premature death in your patients. Nurses are essential to healthcare and everywhere. And in New York State, there's about 405,000 nurses. That's RNs and LPNs. Think of that number. That's huge. If each one of you made the time to talk with your patients about tobacco use, we could make a significant difference. If a quarter of those patients quit, that would be 100,000 individuals that you've changed their lives. If just an eighth of those individuals quit, that's 50,000 people. Since last March, 52,000 people have died of COVID. So just think of the impact we could have as a profession. Some days it feels like you have no time, right? You're all over the place. But listen to your patients. Just in your routine assessment and care of them, find a teachable moment. A lot of times teachable moments are when they're in hospitalization. Somebody had a recent heart attack. The patients that you see over and over again every year that have a COPD exacerbation. Listen to them. Find some teachable moment. Somebody just found out they're pregnant. Good opportunity for a teachable moment. A new diagnosis of cancer, or a parent who just experienced a severe asthma attack with their child and now is like freaked out because they're asthmatic. Listen to them. It takes less than a minute for you to just say to somebody, hey, how might your life be better if you gave up smoking or vaping or chewing? And then just stand back and listen to what they tell you. I think they'll tell you a lot if they're ready. In honor of Nurses Week, I want to share a quote with you by Florence Nightingale, who is the hero of nurses and has made such an impact on the healthcare system. So never lose an opportunity of urging practical beginning, however small, for it is wonderful how often in such matters the mustard seed germinates and roots itself. But don't ever underestimate the difference that you make every day, and go plant some seeds. That's all I have to say.
Oh, that's fantastic. And thank you both, Ann and Kathy. There's your round of applause for sharing your wisdom, your expertise, and most of all, your inspiration. I'm all fired up right now, and I'm sure all the nurses attending today are. And to continue this wonderful enthusiasm and support for nurses, I'm going to turn it over to Paula Celestino to ask our panelists, our additional panelists, some questions. Paula?
Thank you, Pat. And yes, thank you all again for agreeing to do this. Accolades to all. And I love listening to you. So I'm going to get right into it and ask my first question to Pat. So Pat, I'd like to ask you, we know that there's evidence-based treatments to assist tobacco users with their quit attempts, including health plan benefits for cessation medications and sometimes additional support programming. What steps can be taken by nurses or healthcare facilities to standardize providing access to treatment to tobacco-using patients?
Well, Paula, I think one of the most important steps to standardize access is to ensure that healthcare organizations have comprehensive policies in place that ensures that their providers address tobacco use with every patient at every visit. Another important step is to have tobacco dependence guidelines embedded in electronic health records, as I think Ann may have mentioned. This prompts nurses as well as all practitioners to assist and treat their patients who use tobacco. I think it is so important for nurses to do this work, but I think if they hear it from their nurse, from their doctor, from the respiratory therapist, from everyone that's involved in their care, it really resonates with the patients that maybe this is something I really need to do. Also, providing tobacco dependence treatment education and training for nurses on a regular scheduled basis would be helpful to enhance their confidence in their ability to assist their tobacco-dependent patients. A lot of times I've heard nurses say, you know, I don't know what to say. I've never smoked or whatever. And but you know, they need their confidence built up. And I think with education we can do that, and sort of role playing with them and give them a chance to really talk about it and help a patient. And to remind, as other people have said, to approach our patients with a non-judgmental, caring manner. We have heard from patients that they don't even tell their doctors that they smoke anymore because they feel like they're being judged, that there's a stigma to this situation, that this, you know, smoking is so stigmatized now than it was years ago. I think this will result in patients being more receptive to treatment and making a quit attempt. And finally, in addition to knowing about tobacco dependence treatment education and how to do it, I think knowing about the resources like the New York State Smokers Quitline really advance that, so that patients will have follow-up after they have that initial counseling, and also being aware of the benefits provided by the Medicaid and other insurance plans that include the FDA-approved cessation medications that they may not have to pay for, that they can get it through their insurance or through Medicaid, and that there's reimbursement for counseling for certain practitioners. Not for RNs yet, but I hope that happens soon. I know it's for doctors, nurse practitioners, and PAs, but I'm advocating for nurses to get that reimbursement as well. I think all of these steps would be very helpful in improving access to evidence-based tobacco dependence treatment.
Well, thank you, Pat. I think you just wrote the handbook. That was lovely. I mean, you right to the point. You talked about some of the systemic changes around policy, implementing the guidelines, getting it into our electronic medical records, providing training, and cultivating the culture of normalizing the quit process, along with providing resources. So you covered a lot of areas, and I thank you for that very thoughtful answer. So let's move on to our next question for you, Pat. Although tobacco-using nurses may know the risks, they may perceive reasons to continue their tobacco use, and we have touched on this a little bit. Some nurses say they feel hypocritical giving patients face-to-face interventions on smoking cessation when they themselves smoke. What steps can be taken to address tobacco use among nurses for themselves and for their tobacco-using patients?
Yeah, this is a challenging question, but I do want to say that surveys have shown over the past several years that although nurses used to smoke at very high rates, there is a significant decline in the number of nurses or percentage of nurses that smoke, you know, probably due to many of the tobacco control policies in place, not only in New York, but nationally. But also surveys show, as you mentioned, that nurses who smoke are much less likely to offer cessation advice to their patients. I think that nurses who smoke should be offered tobacco dependence treatment and support, ideally where they work, and also, of course, information about the Quitline. I think making sure that nurses and all employees can receive cessation medications through their health plans without a copay is an important step as well. In offering incentives and education about tobacco dependence treatment to nurses may motivate them to make a quit attempt. For instance, in our health system, people who are employees who make a quit attempt through a program are offered a wellness credit, which means that they get a discount on their insurance fees, and they also are offered a gift card just for trying. So I think those little they're not huge amounts of money or anything, but it is an incentive that says, gee, you know, maybe this is valued, something that I can try. One of the other things I think that is that nurses who smoke may be in a very unique position of being able to offer their patients even more empathy than other practitioners, since they know the challenges involved in quitting. They know it's not easy. They may have tried themselves many times. So I think having a real conversation about tobacco use between their patient, and an understanding, knowledgeable nurse may provide the impetus for both of them to move towards tobacco-free living. You know, we've had patients who went to a local cessation program and were hospitalized, and while they were in the course of being there, they met nurses who would reach in to maybe take their blood pressure, and they said, gee, you know, you smell like smoke. You should go to the cessation program that's around here. And actually, those patients helped those nurses to make a change. And I believe, and I know from those nurses that that made them even better advocates for their patients in the future once they quit.
Once again, thank you so much, Pat. And thank you for reminding us that the trend is going in the right direction with less nurses smoking. And hopefully that's a result of some of the things you talked about in terms of offering treatment. I like the idea of making sure they have support right where they work, and the idea of motivating quit attempts. We know that that's a very powerful way to get people to think about quitting smoking, and really kind of the idea of using their experiences to talk to their tobacco using patients really does kind of like go back to that whole idea of normalizing it. You know, it happens to me, it can happen to you. This is the way it went. So I really appreciate, I think we all really just appreciated your very thoughtful insights for those questions. Thank you. So I'm going to turn to Rose now and start with Rose's first question. So, Rose, becoming and staying tobacco-free, we know, are the best behavior changes a tobacco user can make for his or her own health. Yet we know tobacco users aren't often ready to quit, or they're not ready to retry to quit, to retry the quit process again, as many do it several times. What suggestions do you have for nurses who find their patients just aren't ready to quit?
Okay, first I want to give a shout out to all the nurses here on the panel and that are watching the webinar now for a Happy Nurses Week. So that's a really good question. This happens to be right up my alley in terms of motivational interviewing. So I want to build on some of the things that Anne and Kathy have said, that, you know, chances are that as a nurse, you're already working with someone who either has or is on the verge of having a diagnosis of some smoking related illness. So that's a really good place to start. Something like this very often will motivate people to quit smoking. And the nurse is in a perfect position to be able to educate people on how quitting smoking now can either slow down or actually ameliorate the process. So very many people come to me because they've received a diagnosis or they've received a stern warning and they're frightened enough to want to quit. For others that are not quite there yet, the best way to accelerate that process is through motivational interviewing. And motivational interviewing is a lot about identifying and quantifying experiences in order to help the person determine the relative value of the behavior change that you're hoping to achieve. Now, there are a lot of methods of motivational interviewing, but today I'm just going to describe the easiest and for me has been often the most successful. And that is just the good old-fashioned pro and con list. Now, it's usually very easy for people to list what they feel is positive about smoking. And they often need help to identify the cons. And that's where the tobacco cessation specialist or nurse can really come in and move in on that. I bring up things such as the odor of smoking, the social stigma, and the really, really big thing for a lot of people is the cost. And for that, I am very grateful to have the use of the Quitline's cost of smoking calculator. It really brings front and center the amount of money that people are spending on cigarettes. And people have said, wow, that's my rent, or that's my mortgage, or that would be a car payment on a pretty nice car. So, so that's a real eye opener for most people. And a lot of time that can be the final intervention to get them to seek help to quit smoking. I also want to talk for a minute about what Kathy said during reading the Florence Nightingale statement about planting a seed. It's so important to be able to plant that seed, and you never know when it's going to grow something. And I've worked with people, so many people who I've planted the seed with, and then, in a month they came back to me. In 2 months, in 5 months, or maybe their psychotherapist asked them about it, and then they came back to me and they were a successful quitter. So there's really a lot to be said for planting that seed. You're not going to always see the results right away. Another motivator that I use, I'm going to see if I can get this into the camera or not. Can you guys see that? This is called the Ciggy Piggy. And the Ciggy Piggy, I use it very successfully with people. So the idea of the Ciggy Piggy is to save all of the money that you use from smoking. So if you smoke a pack a day and say that's, $10 or $12 a day, you should still spend that $10 or $12 a day, but you put it in the Ciggy Piggy instead of just keeping it in your wallet and letting it get lost with all the rest of the money in there. And then at the end of a week, you have a significant amount of money in there. And that's a very tangible symbol for people. And I've used the Ciggy Piggy very, very effectively with my folks.
Wow, Rose, that was fun, actually. That was a lot of fun. I mean, you were able to, to bring in, motivational interviewing, and we know that's evidence-based, and you laid that out very well with your examples. Thank you for that. And your concrete examples of planting the seed, reminding us that sometimes what we do takes time, especially in the work that we do, and the importance of a little bit can go a long way. And then, Ciggy Piggy, I mean, what can I say? I just, those kinds of things work. People don't like to be lectured, and they do remember things like that. So thank you so much for all of those concrete examples. And that was a lot of fun. So I'm going to move on to your next question. So throughout your career, you have experienced success in assisting tobacco users. When you recall helping those tobacco using patients, what are some of the elements that contributed to their quit success?
Okay, this is a really good question. There are often several elements that a quitter needs to be successful. And there are just as many for whom only a single element is critical. For most folks that I've successfully guided through quitting, it's usually a combination of encouragement that they get through counseling with me, information, and NRT or nicotine replacement therapy. Having a quit buddy that can talk with you or you can get encouraging texts from is very, very helpful. If they have a living partner that smokes, it is crucial that those people quit smoking together in order to decrease the temptation by the other to smoke. It also provides encouragement through a shared experience. So it's really difficult for people to quit smoking if they live with a smoker who refuses to quit or refuses to go outside of the house to smoke. So the second element is education. I'm very fond of quoting statistics because it gives information that a person can put into the context of their own experience. So my goal for the information is to both encourage and reassure them. So for example, I'll tell them that it takes most people between 7 and 10 quit attempts before they're successful, but also that with every subsequent quit attempt, they are more likely to be successful than on previous attempts. And we talk about, and this is, I believe Anne and Kathy and Pat probably all brought up about how hard it is to quit smoking, and that nicotine is really a brain disease, and that the reason is that quitting is so hard is because nicotine is a very addictive substance. I also tell people that, if this was easy, everyone would be doing it. And that's really true because I haven't met very many people who really want to smoke. So one of the strongest elements for success, in my opinion, is the use of nicotine replacement therapy. As most of us know, the uses of NRT makes you 50% more likely to be successful in this particular quit attempt than someone who doesn't. And there's a lot of people who think that the use of NRT is somehow cheating and that their quit is not valid. But I've a lot of times been able to get people who are sitting on the fence in terms of wanting to use NRT or not wanting to use NRT, and that statistic is helpful to get people onto the other side of the fence to use the NRT. And also building on what everybody has said before, the people that I've helped quit said that the unconditional support and the idea that they're not alone has meant the most to them, and that having that support was critical in their in their success in quitting.
Thank you, Rose. That again was a lot of really practical and helpful information, providing encouragement being at the top, along with encouraging, the nicotine replacement therapy, which requires sometimes myth busting and helping people understand really what it is and how it works and how to use it. Wrapping in other people you live with, sometimes we don't ask those extender questions. So I think that sounded really important. And the idea of education, sometimes we like to assume, I find that people know all of this already, but they really don't. And they need to be reminded the way you suggested, making it relevant, to their own personal experiences. And so I, just want to say that both of your answers were wonderful, and appreciate all of your wisdom along with all the other panelists. Thank you so very much. Now we're going to move into the second part of our presentation. I just want to preface this a little bit with a little bit of information that for the last 10 years, the Centers for Disease Control and Prevention has conducted the TIPS from a Former Smoker multimedia campaign, which profiles real people who are living with serious long-term health effects from smoking and secondhand smoke. And chances are you've all seen these commercials. This campaign has a goal of building public awareness of the health implications related to smoking. The TIPS campaign encourages smoking cessation and urges people who do not smoke to protect themselves from secondhand smoke exposure. In addition to this, the American Association of Nurse Practitioners, the American College of Nurse Midwives, and the American Nursing Association have partnered with the CDC to help promote some of the free TIPS patient materials to use in their practice. Another resource is provided by CDC, which is a case study that highlights how healthcare systems and providers can use the TIPS resources and materials to encourage their patients to quit smoking. These resources can be found on the CDC TIPS healthcare provider web pages, and how the TIPS can be a resource for tobacco users in the healthcare settings. We're now going to tell you a little bit about some of those additional resources along with the CDC resources. So to start out, we're going to talk about our program, which is the New York State Smokers Quitline. And the New York State Smokers Quitline is based at Roswell Park Comprehensive Cancer Center, located in Buffalo, New York, and it's funded through the New York State Department of Health Bureau of Tobacco Control. We are moving into celebrating our 21st year of providing free cessation services and support and resources, and we've served well over 200.5 million New York tobacco users who come to our services for help over those years. Next, Tony. Thank you. So specifically, the services that are provided through the New York State Smokers Quitline for tobacco users and end users, electronic nicotine device users, include coaching that is provided by our trained coaches in tobacco dependence treatment specialists. They're rigorously trained, they're set up for certification, and they have lots of experience and education that they bring into these into the services. We do offer up to 3 coaching sessions, and for those who report psychological distress, alcohol and cannabis use, disabilities and pregnancies, some conditions that we've identified that makes it harder to quit, harder to stay quit, we offer up to 6 coaching sessions. We do provide free nicotine replacement therapy, and at this time, folks coming to us can get up to a 4-week or 6-week supply, depending on their eligibility criteria and depending on some of the regions where they are in New York State. And we provide combination therapy, which we know is the gold standard for moderate and heavy users. We'll mail these folks a nicotine patch along with a supply of gum or lozenge, so they have the patch for the long duration nicotine replacement and the acute gum or lozenge for their acute cravings. For those who smoke are lighter smokers, we provide either the patch or the gum or the lozenge. We have a plethora of information on our website, nysmokefree.com for the tobacco user, for healthcare professionals and nurses, for the media, for educators. Please take a peek up at it if you haven't. There is downloadable material on that website. We send out printed material to those folks who are interested, as we mentioned, brochures for you, and certainly a lot of self-help materials for our tobacco using patients. We do our best to be sure we tell everyone about additional cessation services that they may be eligible for, have benefits, and we refer folks sometimes to their healthcare plans for additional medications, additional support services, local programs, or local healthcare programs that they may be interested in following up with, as we know it's a chronic disease. So we give them everything we hope that they can use. Next, Tony. Nope, back one. There you go. So very simply, the three ways that people access the services is they call us. We are still a mostly phone-based at 1-866-NY-QUITS. In addition, when you see the TIPS number, 1-800-QUIT-NOW, which is the national quitline number, those calls get triaged right into our 1-866-NY-QUITS. So we all work together, and those phone numbers are linked together. Folks can also come in through nysmokefree.com. They can go online and request a call. They have a coach call them back, or they can do an application for nicotine replacement therapy to get mailed directly to them. So there's ways to get services through our website and our digital. And finally, we do have referrals by our healthcare professionals like yourself and the people that you work with. We get, a lot of those, thousands. We'd like to get more. We've seen a slope during COVID, and we do hope that information like you're going to be provided today helps to encourage you to kind of, go forward and provide referrals to your tobacco using patients to the Quitline. And with that, I am going to hand it over to Pat Grant to talk to you more thoroughly about our patient referral program.
Thank you, Paula. And just as a reminder to those who have to drop off this webinar, we will be sending the recording and slides, so you'll have all this information if you're not able to stay with us. When you think about the Quitline, we are a treatment extender to the on-site services that you are providing, and we do have resources available to all healthcare professionals, as well as information about our patient referral program. As you can see, this is a screenshot of where you can find that information directly about our patient referral program, which is a free, secure, and easy to use treatment extender. And on the next slide, you'll see that you may be asking yourself, well, what's the difference? Why can't I just give the patient the number or have that patient call? Well, we can provide a continuum of care, as we've talked about, and also we provide outcome reports. So as a nurse or a healthcare professional, you'll be able to follow up with your patient to see whether or not when the Quitline called them or contacted them, did they quit? Did they get NRT? Did they refuse to quit? And one of our panelists mentioned about this being a teachable moment. And this is a teachable moment to use this as an opportunity to help them in successful quit attempts. As Rose said, it may not just take one attempt to be successful, and you may need to support them in future quit attempts. And we can help you to set up a healthcare system that is more seamless, consistent, and effective. And on the next slide, you can see that the patient referral program is easy to use. You can send an e-referral through the Quitline portal. You can do batch referrals from your facility. You can do e-fax. We have some rural sites that use the traditional fax. Probably our most popular, without a doubt, is our secure online referrals that takes less than 1 to 2 minutes to complete. We offer tremendous technical assistance, and we will customize referral forms for your individual healthcare professionals as well as for the general healthcare site. And we work with our wonderful partners, the Health Systems for Tobacco-Free New York, to provide training. And right now it will be virtual training, but we're able to do that for you and as much support as you need. And as you can see on the screenshot, that's an example of the outcome report that you would receive in terms of their call outcome with the Quitline intervention. And on the next slide, you can see where there's more information, not only about the patient referral program, but also you'll see a dosing chart, materials. We encourage you at the beginning of the webinar to order up to 100 free of some patient brochures. They're also downloadable if you prefer to have them that way. And there's information about what does it mean to have a health systems change, what's involved in that, as well as the DOH site, Talk to Your Patients. Local programs are listed, so you can check by county, and then billing codes. That's always an important concern that people have. Will we be reimbursed? And all the information is available. Stay tuned as we're updating much of the information as needed. And on the next slide, we wanted to include, Paula talked about some of these other resources, and I won't go through each of them, but there are, on this slide, you'll see that we are including the ANA position statement for you. You can download the PDF, as well as we're leveraging with the CDC's 10 years of tips campaign. They have case studies and resources available. And as was mentioned during the panel discussion, we have the report of the Surgeon General, which was updated in 2020. So just incredible information and free tools and resources for you. And on the next slide, as we wind down the main portion of the program today, there's some key takeaways. We've heard over and over again from our wonderful panelists that nurses play a critical role in addressing tobacco dependence treatment. And even a brief intervention, Rose talked about motivational interviewing, 1 to 3 minutes can make a difference in supporting a patient's cessation attempts. Our referral program provides that extended cessation support. It's easy to use. You can contact us. Any of our staff will be happy to assist you with that. And there are incredible resources available to you. As I mentioned, here are some of the resources we've talked about, and as an appendix to this information that we're providing for you today will include more details about each of the resources. Next, okay. So stay tuned for our bonus chat. And before we get to that, I just want to make sure that you know how to contact all of us. There's Paula's, mine, and Tony's information. And please feel free to reach out by phone or email. And we had a quote earlier from Kathy with Florence Nightingale, but I also had a quote I wanted to include. And this is, let us never consider ourselves finished nurses. We must be learning all of our lives. And kudos to everybody who joined us today and put yourself as a priority in learning to be able to assist tobacco using patients, and maybe in some cases your peers, to be tobacco free. So thank you to those who need to drop off, and stay tuned. I'm going to turn it back to Tony for our bonus chat. Tony, it looks
Tony,
like you might be on mute.
On mute.
Okay, we're going to get Tony back here, and I think he has some questions that were in the chat.
There we go. I had no idea I had no idea I was on mute. I was talking and didn't even see that. My apologies. Gotta love technology in the age of COVID. Well, welcome back, everyone. We do have a number of great questions that were asked here. We're going to turn it back now to our 4 stars of the day, our illustrious nurses here. And the first 2 questions are actually very, very similar. I'll pose them both, asked by Patty in the chat as well as Dawn. And in fact, I'm going to direct this first to Rose, given her role as a psychiatric nurse, and of course anybody else who would like to chime in. So the questions here: do you have any extra tips or info to help patients with schizophrenia to stop smoking? And Dawn likewise said she's very interested in tips for counseling clients with mental illness and schizophrenics in particular. So we'll start with you, Rose.
Okay, thanks for that, Tony. That's a excuse me, I'm sorry. That's a really good question, and please excuse me. The schizophrenic population is particularly difficult to get to quit smoking. the mentally ill smoke 40% of the cigarettes that are purchased in this country. When I'm working with somebody with schizophrenia, I often have to decrease them in very small amounts, very, very gradually. We can't really set a quit date because it's usually too overwhelming. I had a woman who used to smoke 8 cigarettes just with her morning coffee. And before we could set a quit date, I had to get her down to a pack a day. Anyway, one thing about working with the mentally ill is when they are hospitalized, which unfortunately sometimes they are, and they can't smoke, they are given NRT in the hospital. And I've been able to successfully get the psychiatrists at our local hospital to always prescribe NRT for people when they're leaving the hospital. So sometimes that's how we're able to do it. But overall, you really need to be able to develop a relationship with a person who is suffering some schizophrenia, and that's that's a really difficult thing for them to do. But a caring person can do that, and it takes time. But I would say that taking the time to develop that relationship and going very slowly, going very, very slowly.
Fantastic. Thank you, Rose. Did anybody want to piggyback off that or chime in further for our panelists here?
I just wanted to say that, we have at our health system, we run an in-person cessation program. And we found that patients who reported severe mental illness like schizophrenia, bipolar, although they needed generally more support and longer term cessation medications, at 1 year, when we looked at our study, they had the same quit rates as people that did not report mental health disorders. So I think that giving them what they need and working with them on their, on their level and what they need, can be they can be just as successful. So what I'm trying to say is I don't think we should shy away from what a lot of people would say, oh, let them keep smoking. And yet when they came to our program on their own, of course, they were as successful as those who did not report any mental health disorders. So I just think we should always try with that population for sure.
Fantastic. I'm going to turn this just for the sake of time to another question we had, and I think this is relevant to everyone here. And in fact, I went through training myself just before the pandemic, was able to get this in. Amber asked, how does one become a trained tobacco specialist? I'm actually going to turn this over first to Ann. Yeah, you read my mind. Ann, you're not only trained, you are nationally certified. Congratulations. So, Ann, perhaps you can start us off with answering this question.
Well, as an oncology nurse, I had a lot of interest in helping people to stop smoking. And when I became a community outreach nurse for the Cancer Care Center, I made it one of my goals. So I took a local Butt Stops Here facilitator class through our local tobacco-free coalition and our community for well-being. From there, I started to take classes, and ultimately I was invited to take part in a certified tobacco training cessation class that, I don't know, it was 2 days or 3 days through the University of Massachusetts. And I was very fortunate to have gotten a scholarship for that because I could not have paid it out of pocket for sure. And then from there, you have to build up your hours and experience and helping others and that kind of thing. Once I built up my hours, I applied for the national certification, and I just got that last fall. So I'm currently nationally certified as a tobacco training professional.
Fantastic, Ann. Actually, and I know that Paula at Celestino has a few more things to add to this as well. We can't see her, but we can hear her. So, Paula?
Yeah, thank you so much. So there is a national association called the Association for the Treatment of Tobacco Use and Dependence, ATUD. And on that website, we will send you the link with our follow-up to this. On that website, there is a list of tobacco dependence treatment training programs. There are several across the country, and I know that many of them are now doing online trainings. So you may want to just take a look at what might fit for you, the costs, but they all are relative. They all cover core competencies. And this group is actually working very hard to get those who are certified in tobacco dependence treatment as those folks who can be reimbursed through healthcare plans along with nurses. So it's a great resource, and we'll send you that link so you have options for trainings.
I just wanted to add, at our health system, myself and 3 of my colleagues have the certification also, and we had been doing cessation counseling before that, but we learned so much at that certification training. It was 5 days. We went to Rutgers, but it was really, really helpful. And just to talk to colleagues about this who were so passionate and so, knowledgeable, it was really a great experience. So if you get the opportunity, I would encourage people to do it for sure.
Wonderful. Thank you all so very much. We're actually just hitting up on 1 o'clock, and we're all set in terms of seeing our questions in the Q&A box. With that, we'll wrap up for today, but I want to again extend on behalf of the Quitline major thanks to Ann, Pat, Kathy, and Rose for sharing their time today, their experiences, and their knowledge. This was a really fantastic, robust panel with a lot of learning, and I encourage all of you who are listening in right now, whether live or recorded, to please keep in touch with the Quitline at nysmokefree.com. We're happy to continue the conversations, answer any questions you have. If you'd like to be in touch with any of these nurses or other partners that we work with, happy to do that as well. And we, again, sincerely, from the bottom of our hearts, want to give just an incredible amount of thanks and shout out to the tremendous work that nurses do each and every day, and particularly during this ongoing COVID-19 pandemic. It's not easy, but we are, so grateful for everything that you do, being on the front line of taking care of patients, especially tobacco using patients. And if we can leave everybody with one thought, that's just to remember that smoking and tobacco use, tobacco dependence, it does take a break no matter what pandemic or anything pops up. So please continue to keep that front of mind, because when those issues are helped, it really helps so many other issues. It has a wonderful trickle-down effect for improving health. So with that, we will be signing off. Please stay tuned via email the slides, the recording, links to other helpful resources. And of course, if you're not already on our email list, visit our newsroom at nysmokefree.com and get signed up today so that you won't miss out on future great panel discussions like this. But again, for Paula, Pat, and myself with the Marketing and Outreach team at the New York State Smokers Quitline, thank you so much for today's discussion. Happy Nurses Week. And if it were our way, we'd make it Nurses Year. Thank you again to all 4 of you. Have a great rest of your day, everybody, and keep referring your patients. Thank you.
Thanks, Tony.
Thank you.
Thank you.
Thank you very much. Bye-bye.
Thank you so much.
Bye-bye.